ashver.com.
Hello and welcome to ashver.com. You are watching an interesting video on misalignment of neck or spine may be causing you migraine.
Please read the disclaimer carefully.
Cervicogenic headache or cervicogenic migraine? Yes, I know it sounds like you might be trying to get rid of a hairball. But cervicogenic comes from cervico meaning neck, and genic meaning relating to. These headaches are caused by the neck and by some definitions the spine. Have you ever woken up with a headache and a nasty crook in the neck? The two are probably related. To distinguish them from the more common tension headache caused by muscle tension around the shoulders and neck or migraine headaches with many causes, a cervicogenic headache is generally caused from a neck vertebra being partially out of alignment, subluxed. In my own case, it also involves the pelvis being out of whack. This causes irritation of nerves, especially the occipital nerve. Nerve irritation can also be caused by muscle spasms which may accompany the subluxation or be independent of. Is it a migraine or a tension headache? To distinguish them from the more common tension headache caused by muscle tension around the shoulders and neck or migraine headaches with many causes, a cervicogenic headache is generally caused from a neck vertebrae being partially out of alignment, subluxed. This causes irritation of nerves, especially the occipital nerve. Nerve irritation can also be caused by muscle spasms which may accompany the subluxation or be independent of. How can this cause so much pain? The neck and base of the skull is a very complex area full of bones, muscles, blood vessels, and nerves. With so much going on, it's easy to see why one little spasm or misalignment can cause problems, like a tipped-over truck in Manhattan traffic. Either the subluxed joint or the angry muscle can put undesired pressure on blood vessels and sensitive nerves, especially the occipital nerve. According to the National Institute of Neurological Disorders and Stroke, the pain caused by the occipital nerve starts at the base of the neck and spreads upwards to the scalp. Sometimes the pain will also include the scalp, forehead, and behind the eye. What causes this cervicogenic headache? Whiplash or other neck injury can certainly be the cause. But a crooked spine, bad crick in your neck, arthritis, and in my case Ehlers-Danlos syndrome can also be causes. More commonly though, it can be caused by our lifestyle. Modern life includes computers, driving, handheld devices, and watching TV, all create severe stress on our neck and shoulders. While we know we should take constant breaks from these activities, we forget. Holding our arms out in front of us and or cocking our necks to see the screen properly, we put pressure on our neck and shoulders that our body wasn't built for. This sets us up for muscle and joint strain and pain. This often causes tension headaches. But repetition of the poor posture can weaken muscles that normally hold our necks in alignment. When they weaken over time, the cervical bones can move around in ways that they shouldn't, pinching, squeezing, and generally wreaking havoc. The muscle spasms also caused by long-term bad posture can do the same. Is it a migraine, a tension headache, sinus headache or a cervicogenic headache? About 42 million Americans suffer from headaches. 20% of chronic headaches are said to be cervicogenic. 4 times as many women as men experience these. There are many kinds of headaches including migraine, tension, and sinus headaches. There can also be a lot of reasons for them: poor posture, chemical or food sensitivity, vision changes, colds, hormones or stress. Sometimes, it's even a combination of these factors. However, migraine and tension headaches most closely mimic a cervicogenic headache. Unfortunately, you are much more likely to be diagnosed with migraine or stress headaches since so many of the symptoms are the same. For instance, they all can affect one side, consist of severe throbbing pain, nausea, sensitivity to sound and or light. Because diagnostic tests, blood work, X-rays, and MRIs are mostly ineffective in this case, cervicogenic headaches are still widely underdiagnosed. According to the National Institute for Health, they are even considered controversial. In other words, many doctors don't believe in them. If a practitioner does suspect a cervicogenic headache, the traditional way of diagnosing it is to do a neural blockade in the neck. However, according to the Journal of the American Osteopathic Association, diagnostic criteria have been developed which provide a detailed, clinically useful description of the condition. This allows for a diagnosis without the need for the How are these headaches treated? Generally, cervicogenic headaches are treated most effectively with a multifaceted approach. Since no real studies have been done, this information is gleaned from anecdotal evidence. Pain medications, although considered a temporary fix, pharmaceuticals can be helpful to survive a headache and relieve the stress pain causes. Generally, a combination of migraine medicines, NSAIDs, and perhaps anticonvulsive, antidepressant, or muscle relaxants can be helpful. Narcotic medicines are not considered effective in this case. Important: you must discuss these medicines with your primary care practitioner as the side effects need to be monitored with regular blood work. Manual therapy, manipulation of the musculoskeletal system can help correct the misalignment. Reputable chiropractors, osteopathic doctors who specialize in manipulation, and physiotherapists can help realign the joints, often permanently after a series of visits. Physical and occupational therapy. These are important modalities to help you correct posture and other lifestyle habits that created the misalignment and muscle spasms in the first place. Long-term results. Approaching your healthcare provider about your headache. As I always recommend for any condition that is uncommon or at least not commonly diagnosed, do your research. Spend time looking for information about your headache. When you find information that rings a bell, print it out. Highlight the information that resonates with you. If you find that your headaches fit into the cervicogenic profile, make an appointment with your healthcare provider to discuss this. When you schedule the appointment, be sure to ask for a consultation so you have adequate time to talk without feeling rushed. Bring copies of your printed information that you can give them along with a cheat sheet with your particular symptoms and experiences. This helps keep the consultation on track. It's also helpful if you know which direction you would like to go for treatment. If your practitioner seems skeptical, give them time to digest this new information and do their own research, and make another consultation appointment. No practitioner can know everything. If they are not willing to listen or become your partner, search for another practitioner. Remember, this is your body and you deserve the best care you can get. But it is your responsibility to take proactive steps to get the care. Things you can do. Prevention is always the best medicine. I get far fewer of these headaches now that I know what they are and some things that cause them. For instance, I have found that when I sleep with my head flopped to the right, I'm sure to wake up in trouble. So, I have a few methods to prevent this. Prop my pillow up slightly on that side, usually just using a towel under it. If I've been getting mild headaches that I know are caused by misalignment, I wear my cervical collar to bed. It's not the most comfortable thing, but is way better than the really severe headaches these mild ones can turn into. I have several different pillows that work well depending on my needs. Sometimes I need something more firm, others soft. I also try to spend 15 minutes a day on my Release neck and shoulder relaxer. I have prevented cervicogenic headaches that were imminent by doing this, even in the middle of night if I wake up with one starting. I get regularly treated by an osteopath who does low-impact manual therapy. Most people won't have the chronic problems that I have due to my Ehlers-Danlos syndrome and will be able to straighten out the problem with a few visits. Work on your posture and ergonomics. Be sure that when you work at your computer, for instance, you are practicing good ergonomics. Customize the keyboard and monitor height to your needs. And sit up straight. Our teachers and parents were right. It will hurt at first if you are improving bad posture, but the effort will be. Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find a lot of interesting videos on wide range of topics here. Stay tuned and keep watching.